COVID-19, while a condition with obvious medical ramifications, is also a condition of relevance to mental health, to psychology, both for patients and providers. To care for patients suffering from COVID-19 and to be competent and capable providers, we need to attend not only to physical and medical issues, but to more holistic psychological issues. That's the take home. My name is Dr. Jim Jackson. I am a professor of medicine at Vanderbilt University Medical Center and the director of long-term outcomes at the Critical Illness, Brain Dysfunction, and Survivorship Center, where we study COVID-19 survivors and interact with them in a clinical context. The name of this article is Stress and Fear, Clinical Implications for Providers and Patients in the Time of COVID and Beyond. The overview of this study is that, as I referenced, there are mental health and psychological concerns of high relevance, both for COVID-19 survivors after the ICU and crucially for frontline providers who are caring for these patients. We know that living during this COVID-19 season is challenging for everyone. But we think that it is perhaps uniquely challenging for the frontline providers caring for these patients, for ICU nurses and physicians, for people working in the emergency room, for healthcare providers in nursing homes, things of that sort. So in this article, we talk about strategies to try to prevent burnout. We talk about strategies to try to foster self-care. We talk about ways to humanize the patients that critical care providers and hospital providers are interacting with, reminding them that these are people with significant needs. They're not simply patients with COVID-19. They are brothers and sisters, their sons and daughters, often suffering alone and in silence because of visitation restrictions that are so strict. So in this paper, we're really making a plea for a thoughtful, multifaceted, holistic approach to care on the part of providers, also for patients. Clinical implications are many. For medical providers, those implications, again, are that patients may be uniquely frightened, uniquely stressed during this COVID season. They're in the ICU, they're quite alone, they're without family and friends in many cases, no visits from the deacon at church. And we need to be sensitive as providers to the psychological challenges that they're facing. That means that we may need to be more creative than usual in finding ways for patients to connect with their loved ones. That means that we may need to be even more ardent than usual in implementing things like the ABCDEF bundle, in trying to decrease delirium, doing anything we can to preserve and bolster the mental health of these patients. It also means that in the context of long days and long nights caring for COVID-19 patients with stress literally swirling around us, that we need to be much more vigilant, much more diligent about our self-care than we typically are. Healthcare providers are often funny about this. They're very task-oriented. They feel great responsibility to their patients. They are sometimes less inclined than they might be to take care of themselves. They're invested in taking care of other people. And in this paper, we are inviting providers to find thoughtful ways to care for themselves. With regard to patient implications, I think the paper highlights the fact that many patients will themselves experience some degree of stress and difficulty, and we talk about ways that they can alleviate that. One take home that I'll mention here is that for people who have survived COVID during this hard season, there are resources that are available and they should be pursuing those. Rehabilitation resources, psychological resources, help is available, and it's crucially important not to wait. With regard to next steps, we've talked in this article a lot about frameworks. We've talked about frameworks. We've talked about the difficulties that we anticipate providers will experience, patients will experience. Much of the things, many of the issues that we engage in the article, however, they need more research. They need more focused research. So a clear next step is not to simply talk about burnout in ICU physicians, but to study it. Not simply to describe it, but to try to find interventions that ameliorate it. Not only to try to describe, for example, rates of PTSD in COVID survivors, but to try to develop thoughtful interventions that can assist COVID survivors with PTSD. Other next steps are to take the details that we highlighted in this article and to really disseminate those, to communicate on a large scale from a public health standpoint, the magnitude of difficulties and challenges that COVID-19 survivors will have, to educate the public about those and to educate COVID survivors themselves so that when they get home from the hospital, when they get home from the ICU, they will anticipate, they will be aware of the issues coming down the road at them, coming down the pike at them. And if they know to anticipate them, they will be less distressed when they arrive. Thank you.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.